everybody, and welcome to the Healthtech Pigeon podcast, where we take a look at the week's health tech news so you don't have to. Today, I am absolutely delighted to be joined by my colleagues Taffy and producer Adama, taking her first step behind the mic.
I think so.
Yeah,
Yeah, I think so.
It's big news. She's joining us.
Then I'm not really producer Adama anymore, am I?
Former producer Adama.
Lost my job.
But call it promotion.
Thanks.
But yeah, really delighted that you're both joining me today, and of course, thanks to now producer Holly, who has stepped into your seat for today's episode. Yeah, how have your weeks been? How are things?
Good. Yeah, sure. I mean, it's been a great week. The sun has been out. Can't really complain. Vitamin D is topped up. Yeah, it's been a solid week.
Fantastic. Adama, how about you?
Yeah, I must agree. The weather's lovely. It's really nice today as well, actually. But apparently it's supposed to rain next week when producer Holly is off, so hate that for her. But yeah. But it's been a good week all in all. And you, Hugh?
Well, yeah, all good. I've had some leave this week from various reasons. But we won't dive into that. We'll dive into the week's best health tech stories instead. So I guess without further ado, then let's have a chat. We've got some really exciting stories to chat about this week. Some interesting policy announcements and some interesting sector analysis to have a look at. So let's go ahead. So our first story today comes to us from Women's Agenda, a startup space where women's representation is growing, digital health. So, as we all know, there's a huge gender gap in the number of companies founded and led by women versus men, as well as the amount of investment women raise versus men, typically. But according to a new report by And Health, digital health is bucking at least one of those trends as a sector. In digital health, the proportion of female founders is getting close to the halfway mark. 44% of digital health companies are founded by women. This compares to just 27% across the overall startup space. Why? Well, And Health, the company that has produced this report and found us these insights, their founder, Bronwyn LeGrice, says that it's because more than 70% of the healthcare workforce are female. So they're the ones most actively looking at tech for ways of making it work better for staff and patients. Not just that, they're also primarily more often than caregivers as well. So there's a full spectrum way of finding out what's going to work and looking at tech as an opportunity to address those problems. But, caveat to this, the funding gap continues to remain, according to the report. Female founders receive an average of 36% less funding than their male counterparts. That figure amounts to an average of $320,000 compared with $500,000 for male founders. So, big questions out of here. I'm going to start with the caveat that this is obviously reporting to the Australian market. So all of the findings that we've gone through here and all of the findings of the report are very much localized to that. Done a bit of cross comparison with the UK market though. Couldn't find all of the figures I want to, but it's an interesting comparison and an interesting question. How are we getting to this point? How are women and men almost even when it comes to founding and leading companies, but the money's just not coming in and the investment's not coming in. Adama, Taffy, you've both had a look at this. What are your initial reactions and takeaways?
Yeah, I think it's great that, we're seeing that we are seeing more female founders in the space. That can only be a good thing. And yeah, I do think it's quite interesting that they mentioned how it's because like women are natural caregivers and things like that. I'm not sure I really like that generalization, just because I think it just puts women in a box. And I think you say just all women are natural caregivers. I don't know. I think that might do more harm than good in the grand scheme of things. But just speaking about healthcare in general, yes, I guess you can say there are a lot of women in healthcare just in general, not just as founders, but just working within the space. So I think it does make sense that we are seeing more female founders. And I think it's great. It's good to see. But the whole funding situation, this is something that we talk about a lot within the team, with our clients and things like that. We've seen a lot of initiatives that kind of support funding for like female founders. And I think it all kind of starts from the top. So, like I said, we speak a lot about this kind of stuff. Speak a lot about like women in VC, for example, and how there aren't a lot of women like on the decision making tables at these VC firms. So it kind of it's like a trickle down effect, whereby if there aren't a lot of women in like the decision making tables, there aren't a lot of women with the power to make the decision to say where this funding is going to go. People may have like biases, whether conscious or unconscious, that trickles down into where this money goes and where the funding goes. Um, and I think also kind of veering away from the point of just like women in general, but I think when we talk about diversity in VCs and diversity in funding, I think we should be a bit more broad with it, and because we all know that diverse teams make better solutions. So I think more emphasis should be put on ensuring that there's diversity across the board within VC firms. So kind of people of different races, people with different socioeconomic backgrounds, and then of course gender as well, because when making these funding decisions, especially in a sector like healthcare where it's meant to be for the masses, meant to be for everybody. So I think that those making the decisions should represent the people that they're making the decisions for. So we should have more diversity like across the board um when it comes to like making these funding decisions so we can represent the population that people are trying to serve essentially.
Yeah, it's an extraordinary finding, though, isn't it? It's the lack of investment going. It does point very much to that systemic bias, that systemic
Yeah.
institutional problem at the VC level of the not receiving the funding. I mean, it does make me wonder whether there is a how we address this challenge. I don't think there's any easy answers, but everything you said on the VC side really does need to be looked at. We do see more funding going to female-led businesses from you know VC firms or investment firms where there is a greater diversity and representation at the at the senior level, don't we? So, I mean, I'd be very interested, frankly, just off the back of this, to see what the kind of um, makeup of Australia's VC firms is off the back of this, because
Mm.
it's such a remarkable, even almost even split um, in terms of the number of founding and leading these companies, but the investment it's remarkably low.
Yeah, it's quite strange, I think, because like you said, it's kind of like an even split. So why, who's the money going to? Who's the money going to? And why isn't it? Yeah, I don't know. It's just weird. It's very strange, I think, and I just think not to like rain on Australia's parade or anything, but like I feel like they're doing themselves a disservice because like we always say like diverse teams, better solutions, more inclusive solutions. So what is going on over there? Basically.
Taffy, what's your takeaways on this one?
It makes sense. I'm so glad the percentage is now being equalized, because a lot of the like the best tech is trying to solve the biggest solutions, right? And I think a lot of the solutions problems that we're seeing is because there wasn't representation to begin with. I know even just this week I heard about how a lot of the textbooks that we read on medical education, it was things founded upon not people represented, whether it's like women or diversity, right? So I think now women are finally being able to speak on these issues within the health system, and no wonder they're now at the forefront of innovation, because they see the issues, their lived experiences, and now they're creating the tech to solve these issues. And I'm just really excited that, okay, there's more representation now with the founders. I'm sure with time it will be reflected with VCs. And I think reading this is actually extremely encouraging that we're like moving forward. And obviously there's always more to go. It's not even at 50% yet. It's 44. But I think this is really encouraging steps moving forward. But I'm really not surprised by it. I don't think it should be surprising, just because, yeah, the biggest issues are because women didn't have themselves, represented, So yeah.
There's I tried to find before the podcast I tried to go out and find some interesting data and find something that kind of backed up this, to see whether the same issues were happening in the UK, the same challenges were faced, but it just ended up raising more questions. So I mean, ultimately, the number in Australia is that there's sort of 70% of the healthcare workforce in Australia are women, which kind of, according to this report, justifies the the larger share of female founders in digital health compared to any other space. And I think that's a really interesting point. And I think those numbers from a healthcare workforce are represented, are fairly similar in both the UK and US in terms of the number of women in working in healthcare. Obviously, there's some structural differences when you get to the number of trainees at certain level versus the number of people in senior positions and senior healthcare positions. So I think we could run an entire episode just talking about those figures alone. So we won't go into that. I did think it was quite an interesting one, and I wonder whether it justified. Well, not justified. I don't think anything justifies these figures. Whether it goes some way to explaining. I think in the UK, it's something in the region of 80 to 90% of femtech founders are women, and I assume femtech falls within what this report's categorizing as digital health. And I did wonder, do we think that a lot of, I mean, Adama, what you were talking about the kind of representation of women in the VC level and the kind of the barriers to investment there, do we think that because so many of that 44% are founding femtech companies, there's VCs are primarily a male-dominated sector, is struggling to kind of recognize the challenges, is struggling to recognize some of those problems that female founders are seeking to address?
I reckon so. I do feel like, I mean, generally speaking, when it comes to just on a personal level, you relate to things more when you see yourself in something. If I see something to do with Black women, I'll just naturally, innately relate to that a bit more. So I think yeah, that's why I say like it all kind of just starts from the top, because of course if there are just more male VCs, obviously we know VC is very male dominated, they're the ones taking up most of the space in the room, then just naturally they will fall to, I guess again, the idea of like the unconscious bias type of thing, or naturally relate to or feel more moved to invest in a certain kind of company rather than perhaps a femtech company. And I guess that's kind of the idea, is that if there are more women on those tables, then we can kind of balance that a little bit more, so that more femtech companies founded by women are also being invested in. But yeah, so that's why, like, even though it's bad and it's not good, I can not. It's like I can kind of get why it is the way it is. So it's just kind of more just doing like the internal work as individuals, realizing that okay, so maybe this is getting a lot of attention, or has been getting a lot of attention recently. Maybe we should just shift the viewpoint to something else. So yeah, that's why I think it all just comes down to having just more diversity in the room, like across the board, not just simply more women in the room, like more women of all races, more women from all walks of life, all backgrounds. And same thing with men, not just simply white men in the room, white men of all races, all walks of life, to kind of have a more well-rounded system as a whole, starting from the top. And I feel like that would trickle down into healthcare as a whole.
I was gonna add really quick to Adam's point. Yeah, like I'm gonna be backing something that I feel like connects with me, if that makes sense as well. And I was gonna say it reminds me of a client that we're currently working with at the moment. And one thing I love about the client is that they don't want to make equity and diversity a thing that's just about like an emotional pull or a tug. They want to make it like a financial driver to businesses as well, like having more like female representation and stuff. And I have a question, like maybe the solution could be, rather than, like I love how Australia is at the forefront of change at the moment, and it makes me think, okay, like what mindsets have the people adopted to bring in more women, because obviously someone had to hire the 44%. So it's like, what kind of mindsets are the people at the top having? Like, what's been the mindset shift? Because maybe that's the ultimate solution, like having new ways of thinking and mindset shifts, or maybe repackaging these companies so that it tailors to the male dominated VCs to back it, if that makes sense. Maybe the solution could also come in learning how to package ideas in a way that would appeal to males as well, if that makes sense. Like, for example, I'm sure like many of the men in VC probably have daughters or wives, you know, maybe there's a way we can tap into making it appeal more to them, if that makes sense. Yeah, because I think it's to do with the way that we think and we process things as well.
So it's a really good kind of question. It's the short term and the long term piece, isn't it? It's how do you make sure that VC is representative, it's diversified, it's bringing in all of these viewpoints, and that the people who would naturally be supportive of female founders, who recognize and identify with the challenges that many female founders are looking to bridge, but also in the short term, how do you overcome it? I think Adam, you nodded. Oh no, sorry, Taffy, you nodded very much to the. It's not just the emotional pull. This is the right thing to do of diversifying investment, but also, it's the financial pull as well. It makes financial sense for VCs. The returns from female founded businesses are high. That we have numerous data points now, particularly generated over the last 5-10 years, that point to the real value of investing in female-led companies, and yet we're still seeing this gap, this challenge. And obviously, the long-term issue is bringing in people who recognize that. The short-term issue is, it is in the interest of VCs now to look at female-led companies and point to that. And I think the refrain we quite often hear is that, this just isn't one for me, from investors, particularly from male investors working with female-led companies, and they don't recognize the issue, therefore it's not one for them to invest in. And it feels like maybe that's something we need to look at now. That's a challenge we need to address now, and kind of working out how that is bringing in those perspectives. And I think from the straight of it, it is if it doesn't resonate with you, but it's clearly a decent opportunity, find those perspectives, work hard to bring them in now. And I think we can push some of that change. I mean, just to Taffy's point, if you are a VC listening to this podcast, please do fill in Kavanagh Health's Women in VC survey. It's a really interesting survey, and they're working on a great initiative to bridge some of the gaps that and barriers that prevent women progressing in VC careers and progressing into those senior positions. Want to hear from women and men working in the industry, so please do fill it in. It'll be a link to the survey will be in the show notes for this episode, so do check it out. But clearly a few bridges to cross before we close this gap for good. Anything else we want to chat about on this story before we move on?
I just find it interesting how you said like some VCs will say like, oh, this just isn't one for me. And I find that like quite like a raised eyebrow, because like you are an investor. Are you not in the business of making money? That's what you're here to do. And if you've been given the facts and the figures that says that investing in this kind of company brings you the money, brings you the return, why would you not? Like, take all the morality aside, all the ethical business aside, all of that stuff, just pure money, financial gain. Why would you it's so silly to me. I don't understand. Like, if I was a VC, I'll be making sure I invest whatever's going to bring me the most amount of money. That's what I'm doing. I don't understand why you wouldn't. It really doesn't make any sense. All morality aside, always is the right thing to do. It's the good thing to do. Yeah, it is. And we should definitely, be moral people, guys. But do you not want money? Are you not in the business of making money? It literally doesn't make any sense to me. I don't understand. But yeah, that was just a thought I had.
We're going to get VC hate mail after this.
I mean, do your job. It's not hard.
Well, on that bombshell perspective, let's move on to the next story. story today comes to us from Digital Health, and that is that Wes Streeting has pledged to retain digital workforce amid NHS reforms. Wes has said that he's going to retain the NHS's digital workforce, despite the fact that, obviously a number of recent developments we've seen, including the abolition of NHS England and a shift towards a more community-based digital and preventative healthcare model. He emphasised the importance of digital talent and enhancing productivity in modernising healthcare. And I think something we can all get behind, given how many something we can all get behind, given the role of digital in improving healthcare and some of the opportunities we've seen off the back of this. I think this can only be really good news. We've seen a lot of announcements over the last 6 months in terms of what's going on in the NHS and what's the merger of NHS England, well, merger or abolition, however we want to call it, of NHS England into Department of Health and Social Care. Some interesting discussions about where this workforce is going to lie, particularly down at the trust level, but also the central level, and of course the ICBs too. But obviously, lots of questions, lots of how this is all going to happen. Taffy, Adama, you've both had a look at this. What's your reaction?
I think it could be looked at in two ways. So when I was reading the article, I saw something that said that there are fears from people within the digital health community, like digital health leaders, that the abolition of NHS England could lead to delays in like funding and things like that. So I do think that's kind of like valid, valid fears, valid worries, valid concerns. Especially as we know, NHS isn't known for being super speedy with things and implementation and things like that. So I can definitely see why and how such a big structural change may be met with some apprehension. But I do think that it's also how it could lead to like maybe bottlenecks and just just delays in general with things getting done and getting moving. But I think that it's also a positive thing because it's kind of like a fresh start, clean slate. We can go with like a digital first approach to things and think of like a digital strategy which is like more centralized and has like a more intentional direction. So I think that whilst I do understand the nervousness surrounding it, it could definitely be something really positive if done well, of course.
Yeah, it's going to be it's going to be a rough time the last few years for the NHS digital workforce, really, with all of the movings around. I think, what was it, NHS X at the time and NHS Digital, and now neither of those organisations exist, and now neither does its sort of do their parent organisations as they get moved on. So there's a lot of questions for this workforce, and this has surely got to be I think, a positive bit of reinforcement coming from the health secretary as he kind of looks to push this ongoing existence and role of the digital workforce in healthcare. And I think it'd be odd not to see this level of backup. Of course, it's all tied into the announcements this week of the clinical entrepreneur program and the announcements of the latest cohort of who's joining that after quite a few delays while they ironed out a lot of the how does digital play in these reforms. And I think probably going to expect, I would hope, maybe some more significant kind of backup and explanations of where it all comes in and where digital will play a role, and where that's going to sit within the overall structure. But I think we're probably a long way away from that. Taffy, what are your reactions on this one?
I think it will either go in two different directions. Like it's either will like completely, slate clean, restructure like a whole new base, and it could even be a digital base. Or I feel that because we're reestablishing everything, maybe there won't be space for the digital because there's just so much change and so much shift. I obviously want it to be more the digital side because there's just so much to gain in like making the health system way more digital. But at the same time, I think there's a lot of unexplored things in the digital world as well. Like we're still trying to understand what would the policies look like, what would data control look like. Even this week, I remember reading something about how because it's so fresh and so new, there are so many, it's prone to errors as well, right? Like imagine I don't know, using digital devices that give prognosis. Imagine if they're off, that affects people's futures, right? So I think when it's done well, and if there are no errors within the digital infrastructure, great. But because it is so fresh, I worry that maybe it's a bit too soon to make it so digital, especially when we're not really secure to begin with, if that makes sense. So they're my thoughts about it.
Well, it comes off the back of some other interesting announcements. I think at last year's spring budget. No, I can't even recall who was in power last year's spring budget. Things have changed so much. But we've seen announcements of 2 billion into NHS digitisation. I think looking very much at a kind of centralised approach from the way the wind is currently travelling, both from a procurement and from a kind of overall strategy piece, which I think quite a few people will probably be quite positive about. There will be definitely detractors, but sort of looking at ways to test, pilot, scale things that definitely work on from a more centralised approach, that can only be a good thing. And of course, this week we've also had the Health Data Research Service announced, which will help people help researchers, clinicians understand how to access data and use that for a variety of purposes, including population health management. So, I mean, I think ultimately it sounds like we're definitely heading in the right direction when it comes to digital. Something that I know many of the people in our network will be quite relieved at. Given our who we work with a lot.
I do have a question though, just really
Go ahead.
quick. Like, what about the population that maybe is a little bit older, that maybe would appreciate things being on paper and having a doctor that, you know, like would take the notes down, or, because I know there's obviously rural parts of the UK where like some patients would appreciate it being less digital and would want their prescriptions on paper rather than it being sent straight to the doctor, and there's that routine that they enjoy and they like. So I wonder if it's possible to merge the two, or like if there is a way in which we can allow maybe the older generation to still experience that, especially I think about patients maybe who have dementia or who have conditions that affect their ability to adapt to like new technology and the new digital health system. Is there a way in which we can still allow that part of society to keep that less digital edge, if that makes sense?
I mean, that's a really good question. I think one that's I think pretty much everyone's struggling with at the moment when it comes to digitization of healthcare. And obviously, I think a lot, even though we're using digital a lot, there's still a lot of the NHS that remains on paper, a lot of healthcare that remains quite, direct. I guess, I mean, from my point of view, it's really clear that there are definitely people who are working to address that. I mean, NHS England, and I assume one thing that will be prioritised as they move towards that shift away will definitely be that focus on addressing health inequalities and um, maintaining services for people who maybe struggle to use digital or would prefer not to. And I think that's definitely been a priority. I know it's part of the work. A lot of um, the those teams with a focus on digital are looking at from the kind of health inequalities overall, bringing in digitization and innovation under the core 20+5 framework. So definitely a lot to be looking at. I think it is something we need to keep an eye on, though. I think, week before last or so in Pigeon, we had a really interesting story about the digital health checks, something that the NHS has been looking at rolling out for quite some time now, with quite a few delays. But they've been initially piloted, and it is just a digital version of a regular health check test form approach that primary care has been relying on for a while. And there are real concerns about will it impact inequalities generally, and make sure that everyone has an opportunity and a chance to get access to this service and these health checks, and make sure that their outcomes are consistent across the board. But we do see those, I think I can't remember where it was rolled out, but the team there were talking about how health inequalities are top of mind as they're rolling out these services. So it's a very interesting point to address, and one I think we're going to have to follow for quite some time to see how this is being reflected in the rollout of these services. But definitely one to watch.
So I did notice throughout the article there was quite a bit on not losing like the workforce, like the digital workforce, and reassuring people that that's still gonna stay intact with this whole new restructuring, which I think is really important that it does, and it shouldn't like be forgotten, because it's all well and good to kind of implement new technologies, new systems, and these kind of things. But if you haven't got the people in place with the expertise to help really implement it and kind of teach other people about it, it'll probably do more harm than good, in the sense that it may like people slow down people's workflows. It may cause like stress, worries, concerns, like again patients as well not feeling confident in what's being used to help deliver their care. So I think with this transition, like ensuring that we have a really good skilled digital workforce should definitely be prioritized so that things aren't slowed down even further. But yeah.
It's a really good point, isn't it? As we move towards this sort of quite centralized focus, so much of digitization is about actual deployment and implementation, and kind of people learning and understanding how to use data, how to use technology, how to use innovation within their workflows. And I think clinicians and healthcare staff overall have quite a lot on their plate. Let's say that.
Mm.
So understanding and adopting these things really does require not just that digital workforce at the central level, or the kind of top of the organization level, but also the people kind of on the ground helping that learning and implementation process take place. And it will be I'm really curious to see whether we'll see kind of more of that capability built up um, at the local and the regional level, because I think right now a lot of it does seem to be down to individuals who do a lot of this on their own time.
Yeah.
The kind of clinical innovation champions, the people pushing this and advocating for this on the ground, are quite often doing so and engaging with these kind of wider programs on digital, within their own time. It's not something they're necessarily always paid for, and there are staff whose role this is, and I think as we kind of, I'm hoping this announcement is a really, it will kind of be backed up by sort of just implementing those capabilities and making sure that they are there, so that when we do sort of fund digitization like this, that there's actually someone capable and the resources is there to implement them and make sure that the workflows work from a provider and a clinician point of view as well.
Yeah, agreed. I think the idea is just to make sure all the time, effort, funding that is going into these technologies, that when it's time for them to be implemented in like everyday life
Mhm.
or everyday work, it's met with as little friction as possible from those that are using it. So that's why, yeah, it is really important to ensure that the it's being considered right at the beginning, that there are people that are able to help teach others about the use of these technologies, how it's going to help them throughout their day, make their lives easier. Because, like you said, clinicians, healthcare staff in general, they've got a lot on their plates already. You don't want to add to that. You want to help reduce to that and using this technology. So just ensuring that it is prioritized that these technologies are being implemented as efficiently and seamlessly as possible is really key, I think.
We've seen what happens when they're not as well. I mean, the Health Foundation's excellent research
Yeah,
from last month
exactly.
in terms of what whether something actually saved time or whether it created more barriers was very
Wow.
revelatory for a lot of these things. So yeah, making sure that those people are there is, I think, how you actually get these technologies working in a way that solves the problem. Well, we'll end things there. Thank you, Adama. Thank you, Taffy, for joining me. Really, really fun conversation, and of course, thank you to Ollie for producing today.
That's
If
Ollie.
you want to find out more about any of the stories we've discussed, you can find all of the stories, plus more, as well as some of the best jobs, podcasts, and events in health tech in the newsletter at healthtechpigeon.com. Thank you so much for listening. We will be back next week.
Bye.
Bye bye.